have a slide about that. So why do we care about this? One, you prefer not to give a presentation me looking at an audience that looks like this. All of you as residents are going to give presentations. That's part of the residency, part of the education. Most likely, you guys will go to a job where you will give some sort of PowerPoint or some sort of educational talk. But even if you're not in an academic center, you're going to be presenting things to people. And these tips can be used in that way, even if it's not PowerPoint, even if it's not teaching learners. And you can make a career out of this. A lot of our alumni and people go around the world and speak at different conferences and presentations, do podcasts. So these tips go for that as well. So first things first, being prepared. And I think this is probably one of the hardest things for anyone giving a presentation, and especially for residents where you guys are really busy doing a lot of things, and preparation for these presentations can be difficult or just fall on the wayside. So we all start here. New presentation. Stare at this for minutes, hours, days, weeks. And then where do you begin? How do you start this? Where do I go from here? And the first kind of pearl that I want to give you, and something I learned by reading a lot about this and people who give presentations for a living, is that a lot of times the easiest thing is to start at the end. And pick your learning points and the things that you want to impart on the audience first, and then work backwards. And again, the presentation that right before me, it was hard to know exactly what the learning points, the things that you wanted to take out of that were. So if you know that there are 3 to 5 things that you want your learners to take out of it, then you can structure the whole presentation based on that. So the adult learner really can only take max 5 points out of a presentation. You should start every presentation with an outline, kind of telling them what you want to tell them, and then a conclusion, tell them what you told them, and then the middle is how you're going to do that. So every good presentation should be set up like this. So the next thing in preparation is know who you're speaking to. So know the education level. Are you speaking to a room of medical students, of various PGY level residents? Are there faculty? So you want to dictate your presentation to those people. Know the culture of the room. My favorite example is that if you're giving a presentation on management of hyperkalemia, if you're in this room and you say caxylate, Dr. Sinner will throw something at you. If you're giving a presentation to internal medicine physicians or renal nephrologists, if you don't say caxylate, they'll throw something at you. So just know who you're speaking to. Put yourself in their shoes. The acronym there is what's in it for me. So I challenge you guys, when you're giving a presentation, think about the people in the room and what they want to get out of this presentation. If it's a PGY1, maybe they want to learn some of the basic algorithms and approaches to different presentations. But if it's a PGY4, they probably want to know the newest and coolest procedure or the best evidence-based medicine for what you're doing. So trying to address all those different learners in the room is the best way to go. And then also manage the expectations of your audience. Tell them what you're going to talk about and focus in on that. This is a pet peeve of mine, doing conference for as long as I have, using multimedia in presentations. So videos are a great way to kind of impart wisdom and show people what you want to teach them. But having a video take on your whole presentation is not a good way to go. The people have come there to hear you speak about it, not for you to present the video. Test your videos. Make sure that they work where you're presenting, and have a backup for any multimedia that you bring to present. So that means arriving early, checking the computer, checking your presentation on the computer, and making sure it works. And then make sure they have the setup that you're expecting. Do they have a dongle? Can you set up your laptop? Do they have access to Google Drive, which if we were presenting in Kings County, that may not be the case. So have your presentation in multiple different formats: email, USB drive, Google Drive, Dropbox. Just make sure that you can give the presentation. Rehearsal of a presentation, I think, is the most underutilized aspect of presentation preparation. I think for residents, definitely, but generally, I believe so. This is pretty much the most important thing I think you can do when you're giving a PowerPoint or giving a lecture. Because you're going to identify the things that don't come out right, the things that you're tripping over when you're saying them, and you're going to know the timing of your presentation. And this doesn't mean to memorize your slides or memorize exactly what you're going to say, but to know the kind of what you want to talk about during each slide and each part of the presentation. So when we're preparing a presentation, so remember, what is the point? What are you trying to get across to your learners? Think about the multimedia and the way you're going to present, and be prepared to figure out how to do that and have backups. And then rehearse. I really can't reiterate that enough. Rehearse your presentation at least once. Do it in a mirror, do it with your family, your significant others, to your children, your pets. I gave a presentation probably like 20 to 30 times to my infant son. He was a great listener. So this is a little bit of a breakout. I'm going to kind of get you guys to participate. And one reason for that is to first give you another pearl that in any presentation, getting the audience involved or having some sort of breakout session in it is really going to re-engage your learners. And it's going to take some of the onus off of you. Speaking for any amount of time straight is not an easy thing to do, and people will lose your attention. I think usually it's about around 5 minutes you start losing about a quarter of the audience. So the first thing we're going to talk about different formats that you can do breakout and get audience engagement. And I put up pictures that should help you figure this out. So what ways can we get audiences involved?
Asking questions.
Asking questions. Good. So what questions can do for you is that they get the audience thinking. They get the audience brainstorming. You can do pre and post testing, so you can have questions that will challenge them and they won't know the answers. And it also engages them into wanting to know what you're going to teach them. A lot of our presenters do this with board reviews so that you get some incentive there saying that this is going to be the thing that you tested and you're spending $1,000 on, so you need to know this. What else?
Simulation.
Simulation. Okay. So this is demonstration based. This is one of the most powerful ways that you can do this. If you have your learners get involved in actually using the tools that you provided them or practicing those tools, that's really where you're going to solidify knowledge more than anything else. So doing simulation, procedure labs, doing case-based exercises, that's going to be the best thing you can do. And last, small groups. So this is just some way that you can have people break out and start learning together. We do this in CBL. It doesn't have to be something that you get into small group rooms or leave the conference room. You could just have people talk amongst themselves, come back with answers, and bring it back to you. So I challenge anybody who's giving a lecture over 20 minutes long that you do something like this in your presentation. I'm sure everyone here is very dynamic, but no one wants to listen to somebody speak for 20 minutes straight. So this is from Confucius. Educational studies have shown that 72 hours after a presentation, a fifth of the information is retained if you just listen. Let me see, what is it? Sorry, I have not retained this. Half if it's discussed. 70% if the learner says what they learned, and 90% if the learner teaches it afterwards. So the way you're going to have your learners retain most is to either discuss it, to reiterate this information, or to use it themselves and teach somebody. And we all know this. When we teach other residents or students, that's when we learn things the best. So what are some issues that you guys see in PowerPoint? RE, last presentation.
Too many words.
Too many words. Too many words. Good. So the slides are for the audience, right? They're not for you to read off of. We see this pretty often. Ideally, you want to have about 1 slide per minute. And you want to use the right type and size of font. The font should be simple. And the general size recommendations are that, so up here is size 28. So for a room you're presenting less than 200 or less, the body should be at least 28. And the title should be 36, which is here. Anything above that should be 36 is the body and 42 is the title. And this is just to ensure that everybody can see what you're writing. There should be no more than 6 bullets per slide and 6 words per bullet. And ideally not having a lot of bullets at all is helpful. And this is just, again, to remind me to say that the slides are not necessarily for you to read, the audience to read off of, and definitely not the presenter to read off of. So what else? What else do you guys see that goes wrong in PowerPoint? Animation, okay. So yeah, I mean, I think a lot of residents use the GIFs and animations. They're funny and cool for about 2 seconds. And then after that, while you're speaking for 1 to 2 minutes on the slide, everybody's just looking at that repeating GIF. Yeah. And it's distracting. No one's listening to you. Me, myself, I look away because it irritates me. So if you are going, I would say don't use them, but if you are going to use them, have another slide right afterwards where that's either turned off or it's gone. So you can show it for a second and then go to another slide with your bullet points, and then you can talk about that. Using a pointer can be effective. I would recommend to try to stay away from it. It can be distracting. It has you turning away from the audience and putting your back oftentimes. And a lot of times if you are nervous, it's just going to exaggerate that. If you've ever used a pointer and you're nervous, you start shaking like this and you don't know where the pointer is. So use some of the tools that are in the PowerPoint slide. So you can do things like this, which it takes 2 seconds, where that's highlighting the things that you want to highlight, and you don't necessarily have to look away from the audience. And then alternative slide designs. We do a lot of words on a slide, and we put that up there for us or for the audience to read. But ideally, you want to have a jarring picture with few words. So a picture is going to get your message across much faster than any amount of words. And what else? What's the last one? Tables, graphs, charts. So if you put any table or graph up in a presentation, this should be something that you spend some time with. It should be something that you walk through the audience. So it shouldn't just be up there for 2 seconds and you don't talk about it. It shouldn't be complex. You should try to keep it simple, something that the audience can follow along. And you should never be apologizing for a table or a graph that you can't read. If you can't read it, then don't use it or reformat it. So something like this. Nobody can read this. Nobody knows what's going on here. Or this one's a common one, right? Sepsis. Or we can do this, which is better. We can probably read that, but when you start zooming into it, you start to lose some of the quality. So again, it may take a little bit longer, but reformatting yourself, making these boxes and increasing the font and the type, or taking out things that you don't care about, is going to make it a much better presentation. All right, now just for communication or speaking faux pas, what are some things that you guys experience, have seen? Ums? Oh. I think I put that in here. So most of the time, ums, so's, fillers basically are due to nerves. Or really what's mostly is due to lack of rehearsal or confidence in what you're doing. So being nervous and being scared about public speaking is a big deal. And a lot of people have problems with this. Rehearsal, again, is really going to be the one thing that's going to make you the most comfortable with your presentation. They say to avoid caffeine, coffee, alcohol the night before or the day of, cold water, and milk, actually. Things that have been shown to help is bananas, funny enough. And if you have a severe fear, you can take a low-dose beta blocker. But I've heard people who've passed out doing that as well. So on the big day of the presentation, probably not a good idea to try that for the first time. Diaphragmatic breathing before or during your presentation can help. So a lot of times before I present, I'll take a couple, like 5 to 10 big deep breaths and kind of just get the oxygen flowing, calm myself down. You can even do that during a presentation. If you find yourself being flustered or lost, just take a pause and take a deep breath. And a lot of times it can be effective even to pause and to re-engage people as well. What do you do with your hands? I've seen lots of things. People, I don't have a pen, clicking pens, hands in your pockets, tapping. So you want to try not to distract the audience. Using your hands a little bit here and there, kind of keeping your elbows at your side is okay, but rash, big hand movements are not the best thing either. So keeping your hands at your side is probably the best bet. What else? I heard eye contact. So eye contact can be tough. This is it's a great tool when you have your PowerPoint slides and you're reading. You don't have to look at anybody. It's wonderful. The experts kind of recommend that you use a Z formation, kind of start at one part of the room and just slowly move back and forth looking at the room. It's easier when you know the audience, and it engages people, and it kind of makes them think like, oh crap, is he looking at me? Is she looking at me? But it's a sign of a good presenter. You should move around the room. I think for the people who know Dr. Foley, he's one of the best people I've seen do this. Presenting in this room, he's a bit all the way up in the back of the room. It really gets people following you and like worried that they're going, the presenter's going to be next to you in a second, and you need to pay attention. So it really engages the audience. And if you are using notes, if it's something that you need to hold on to, you really shouldn't be looking at them the whole time. They should be somewhere maybe where you can kind of glance at it quickly, but it shouldn't be a prop that you're looking at the whole time. What else? Two more. Humor. So humor is a great tool, but it's very important to remember that you have to have appropriate humor and know your audience. You can lose an audience very quickly if they don't agree or think your humor is appropriate, so just remember that. But it's a great thing to use as transition. It's a great thing to re-engage audience members. And it kind of keeps the enthusiasm up in the room. But the big pearl there is to remember who your audience is, and I think probably always err on the side of not being appropriate. I know, we know each other. We know that we're a pretty liberal group, but a lot of people put up political humor, and that may be a risky thing. So it's something to think about, especially if you're giving a presentation in a room that you don't know everybody. And last, time management. So this is a big pet peeve of mine, obviously organizing and running the conferences. You have to know how long your lecture is going to last. And the way you do that is rehearsing it. So the only way you're going to know how long it takes you to present this and how long each slide's going to take is to rehearse your lecture and to know what it's going to take when you're actually saying it out loud. Ideally, any lecture should be about 20 minutes, and that's really what I try to format in conference. Anything over 20 minutes, I think you should have some sort of breakout session or mini lectures, something to break up the monotony of it. You should also involve in your time management. You should be early for your lecture, for your timing of your lecture. You should be there to set up your presentation. If the previous presentation ends early, that you can just jump in. You'll be invited back to give multiple presentations if you're that person who's flexible and able to kind of move with the schedule and be able to work in it anywhere and be adaptable. So when you're getting ready to finish your lecture, what you want to do is you want to finish strong. So you need to have that conclusion and learning point slide. And something I learned by giving this presentation is that should be the last slide of your presentation. So if you're going to ask for questions or have some sort of discussion points, don't make that the last thing. And that we all do that just because we give our learning points and we ask if there's questions. But then the audience may take over your presentation and you don't get to have that last final word. So in your conclusion slide, hopefully your learning points you've repeated throughout the presentation, ideally about 5 times, the research shows. And every presentation should have some sort of summary slide reviewing what you wanted the audience to take out of it. So in questions in a presentation, this can be a slippery slope. You're always afraid that maybe there's going to be somebody who knows more about the subject than you, who's going to ask the question that you don't know the answer to. But you should always have some sort of availability for questions. If it's not in the large forum, maybe invite people to come up to you and ask questions afterwards. And then don't be afraid to take control of the question session. A lot of people take that as an opportunity to get on their soapbox and talk about what they want to talk about. You as the presenter have the opportunity to take that power back. That's why you're standing up there. And you can say, you know what, let's talk about this afterwards, let's do some discussion afterwards. So take on that role, and you can do that as a speaker. And then again, have the last word. Keep your summary points and your learning points to after your question slide. Repeat and paraphrase questions, often if you're in a large room or conference room, so that the whole audience and learners can know what the question was. Don't be afraid to say, I don't know. You're always more of an expert than you think you are, especially as a resident in these situations, because you've read and you've lived with this presentation for hopefully at least a week, if not a month or two. So the reality of you guys giving presentations, you guys are really busy. But I really want to push you not to procrastinate with your presentations. You will be getting the schedule soon, and you'll know when you're going to be doing that. You don't have to make the PowerPoint, but start thinking about it. Think about patients that you see and cases that you're seeing where you can use these in your presentation. And contact your faculty, preceptors as early as possible. Again, you're always more of an expert than you think. You read the papers and everything, the most recent, when you're presenting. So be confident. And don't feel like that you have the imposter syndrome when you're presenting. Even in these set presentations like M&M or CCM, I want you guys to still remember that you should have some sort of outline and some sort of conclusion or learning slides. Figure out what your audience should be taking away from this presentation at the end of the day. And just always remember you guys are learning, so use your faculty, meet with them, rehearse with them if possible. One thing that you can do is you can videotape yourself doing the presentation and send it out to your faculty preceptors, and they can watch that and give you pointers about that as well. And if they don't have time or can't do it, you can send it to me. I'll watch it. Any questions or comments? These are my kids. Faculty, any comments about presentation stuff? So summary, remember every presentation should have a summary and an outline or objective slide. You want to stick to 3, 4, 5 learning points. That's really what people are going to take out of your presentation. Remember how to use PowerPoint. It's for the audience, not for the presenter. Time management is key, and the only way you're going to get to have good time management is to rehearse and then rehearsal. All right, guys. Thank you.
Take 5 minutes, and then we'll wrap up with our final lecture, and then a little bit of fun after the final lecture. Yeah, I called them and said they're coming.
Oh, that might have been that guy that was here. There's some guy here like shooting lasers into the vent. Oh,